Okay, Jeff. So Ozempic and the other GLP-1 agonists are all the rage right now. People are using them around the world for weight loss. Can you tell us, how do they actually work?
Great. So these two drugs, primarily work through this GLP-1 pathway, which is this kind of satiety signaling pathway. It's sort of a natural pathway in the body. When you upregulate it, you get some delay of gastric emptying, which makes you feel a lot more full after having eaten a smaller amount of food. So basically, it restores a lot of satiety to folks. Often when people become overweight or obese, their satiety signaling doesn't work well. They actually get more hungry the more weight they put on. So there is already a lot of natural interruption in this pathway. So by upregulating it, you restore and amplify satiety. So that's how the drugs work. And they can have side effects, but if you think intuitively about this drug, you'll understand why it has the side effects it does, like nausea, constipation, acid reflux, because essentially you're slowing down the release of food from the stomach to the small intestines to some degree, which is why those are common side effects from this medication.
So that makes sense. What are some of tell us a little bit about a success story or some of the biggest impacts you're seeing these class of drugs having on our patients?
So first of all, the two main commercially available drugs right now are semaglutide, which also goes by Ozempic or Wegovy. It can be indicated for weight loss or diabetes. The other drug, which is newer, is called Mounjaro, which the generic name for that is tirzepatide. Tirzepatide is a dual agonist, so it hits GLP-1, it also hits GIP, which is glucose-dependent insulinotropic peptide. So that's why the newer drug works better. It led to almost 24% weight loss versus semaglutide's 15 to 20%. And there's some evidence that there's a little better preservation of muscle mass on the newer derivatives. But again, these drugs basically work on this gastric emptying pathway, but they also work a little bit on insulin secretion, and sometimes that's called the incretin type effect. So these drugs are incredibly effective. So the question was some anecdotes from the clinic. We have a number of patients who are down 30 to 50 pounds. I think we have someone maybe in the 70-pound range as well. These drugs work fairly predictably. I would say the majority of our patients are losing 1 to 2 pounds a week pretty predictably. And a lot of our patients are doing so not even on the max dosing, like on half of the max dosing. So it tends to be pretty cost effective as well if you don't require the maximum dose. Some of our patients do, but many of our patients do not. So yeah, we had a patient last week who was a 5'2" woman who came in originally at 160 pounds. And she also came in at 41% body fat, which is pretty high, and that would definitely increase her risk of a lot of diseases like cancer and diabetes and heart disease. She came for follow-up. She was down 30 pounds, which is about 20% of her body weight. And here's the kicker: her muscle mass was 86 pounds when we first saw her. After she had lost 30 pounds, it was still 86 pounds. So this woman didn't lose an ounce of muscle. She only lost basically what seemed to be 30% fat, and she felt great. She was, I think her main benefit that she reported outside of the weight loss was her sleep had basically miraculously improved. She was sleeping, great again. She also had a lot less sort of physical discomfort, aches and pains. So that's kind of sort of a best case scenario for tirzepatide of what can happen. She happened to be on tirzepatide, but we have plenty of patients on semaglutide who've had very good weight loss as well.
So one of the other things that I was curious about are what the risks are, because we have seen some of these miraculous improvements in people's health and their well-being and their disease risk. But we've had some people complain of certain symptoms, and there are some long-term concerns with caloric restriction. So why don't you tell us a little bit about that and what we're doing here at BioLaunch to prevent those risks?
So we're attentive to the risk analysis on this drug, certainly, and for our patients, we're screening them, in a medical professional way to make sure they're good candidates. If patients have side effects, usually it's just a little bit of nausea, constipation, or acid reflux. We do have some tools to mitigate those, like going to lower but twice weekly dosing, for example. There have been some media concerns for major side effects like gastroparesis or permanent gastroparesis, which is like a permanent effect in the delay of the stomach to release its contents into the small intestine. We haven't seen anything like that in our clinic, and again, our patients are well managed. We're encouraging patients not to lose more than 3 pounds a week, not to take higher than needed doses of this drug. So I think by having that kind of due diligence around how the patients are dosing the drug, we're not going to see what has been reported to be some side effects and some anecdotes in the media. So you got to use these medications responsibly, and if you do so, again, the side effect profile is very good. This drug has a very good safety profile, much better than many other pharmaceutical drugs that are much more commonly prescribed. There can be risks of things like gallstones or maybe pancreatitis, but again, I think that's coming into play for people with those histories potentially, but also if anybody is fasting for a prolonged period of time or really under eating from a caloric standpoint, you could be at higher risk for things like gallstones. So, again, if people are losing 1 to 3 pounds a week, we're not going to probably see those issues. We certainly haven't seen that yet in our clinic.
So here's my last question. You brought up the patient who didn't lose any muscle. That's something that we screen for and we pay attention to and we advise on how they can maintain their muscle. But what are some of the recommendations you're giving for keeping the weight off once you finish using the medication?
2 things. So while you're on the drug, you should ensure adequate protein intake, which might be roughly half your pounds in weight to grams of protein per day. You should ensure adequate physical exercise, particularly resistance training, a few days a week. And more recently, we've been advising 5 grams of creatine a day to patients who are trying to preserve muscle strength and hardness while on this medication, because there's been a lot of clinical studies on creatine over the years, and it's purported to do that. After you're off the drug, basically continuing with healthy diet and exercise. Patients who need more support around nutrition or a nutrition that supports metabolism should meet with our clinical nutritionist. So we're advocating for that. So you have that piece, which is good diet after you land from this drug. Exercise, which is critically important. Some patients will be maintained on certain supplements, which may also activate GLP-1 a little bit, which could potentially be berberine, for example. So supplements, adequate nutrition, and exercise. There are additional tools, but those 3 should ensure a good maintenance. If people, though, find that despite their best efforts, they're gaining weight, then they can revisit these medications or meet with our clinical nutrition staff or meet with their medical provider to explore other tools earlier than later, so that they don't find themselves in a position where 2 or 3 years off this drug, they've regained all their weight.
Thanks, Jeff.
Yeah.